Hi everyone, I'm Sarah and welcome to the Spoony Life and Beyond. Today we are going to be doing a deep dive into Down syndrome. This is not for medical advice, it's for awareness purposes only, and just letting you know that I may not be looking at the camera because I am getting text to speech only due to being blind. I may sometimes stutter or get a little bit lost, so I do apologise if so. So how about we get started and dive on in and learn about Down syndrome. So Down syndrome is a genetic condition caused when an unusual cell division results in an extra full or partial copy of chromosome 21. This extra genetic material causes the developmental changes and physical features of Down syndrome. The term syndrome refers to a set of symptoms that tend to happen together. With a syndrome, there is a pattern of differences or problems. The condition is named after an English physician, John Langdon Down, who first described it. Down syndrome varies in severity among individuals. The condition causes lifelong intellectual disability and developmental delays. It's the most common genetic chromosomal cause of intellectual disability in children. It also commonly causes other medical conditions, including heart and digestive system problems. Better understanding of Down syndrome and early intervention can greatly improve the quality of life for children and adults with this condition and help them live full, fulfilling lives. So some of the symptoms for each person with Down syndrome is individual. So problems with intellectual and developmental are usually mild to moderate. Some people are healthy while others have serious health issues such as heart problems that are present at birth. Children and adults with Down syndrome have distinct face and body features. Though not all people with Down syndrome have the same features, some of the more common features include flattened face and small nose with a flat ridge, small head, small neck, tongue that tends to stick out of the mouth, upward slanting eyelids, and skin fold of the upper eyelid that covers the inner corner of the eye, small rounded ears, wide, small hands with a single crease in the palm and short finger, small feet with a space between the first and second toes, tiny white spots on the coloured part of the eye called the iris. These white spots are called Brushfield's spots. Short height, poor muscle tone in infancy, and joints that are loose and too flexible. Infants with Down syndrome may be average size, but typically they grow slowly and remain shorter than other children the same age. Children with Down syndrome take longer to reach developmental milestones, such as sitting, talking, and walking. Occupational therapy, physical therapy, and speech and language therapy can help improve physical functioning and speech. Intellectual disabilities. So most children with Down syndrome have mild to moderate cognitive impairment. So this means that they have problems with memory, learning new things, focusing on thinking or making decisions that affect their everyday life. Language and speech are delayed. Early intervention and special education services can help children and teens with Down syndrome reach their full potential. Services for adults with Down syndrome can help support living a full life. When to see a doctor. So Down syndrome usually is diagnosed before or at birth, but if you have any questions regarding your pregnancy or your child's growth and development, please do take time to talk to your doctor or other healthcare professionals. So the causes for Down syndrome is human cells usually contain 23 pairs of chromosomes. Only one chromosome in each pair comes from the sperm, the other from the egg. Down syndrome results from an unusual cell division involving chromosome 21. This unusual cell division results in an extra partial or full chromosome 21. This extra genetic material changes how the body and brain develop. It is responsible for the physical features and developmental problems of Down syndrome. Any of the 3 genetic changes can cause Down syndrome. So trisomy 21, about 95% of the time, Down syndrome is caused by trisomy 21. This means the person has 3 copies of chromosome 21 instead of the usual 2 copies. The extra chromosome 21 is in all cells of the body. Trisomy 21 results from an unusual cell division during the development of the sperm cell or the egg cell. Or mosaic Down syndrome. This is a rare form of Down syndrome. People with mosaic Down syndrome have only some cells with an extra copy of chromosome 21. This mosaic of typical and changed cells is caused by an unusual cell division after the egg has been fertilized by the sperm. And translocation Down syndrome. In a small number of people, Down syndrome can occur when a part of chromosome 21 becomes attached and also translocated onto another chromosome. This can happen before or at conception. The person has the usual 2 copies of chromosome 21, but also has extra genetic material from chromosome 21 attached to another chromosome. So is it inherited? Most of the time, Down syndrome is not passed down in families. The condition is caused by a random, unusual cell division. This can happen during the development of the sperm cell or the egg cell, or during early development of the baby in the womb. Translocation Down syndrome can be passed from parent to child, but only small number of children with Down syndrome have translocation, and only some of them inherited it from one of their parents. Either parent may have a balanced translocation. The parent has some rearranged genetic material from chromosome 21 on another chromosome, but no extra genetic material. This means the parent has no signs of Down syndrome, but can pass an unbalanced translocation onto the children, causing Down syndrome in the child. So the risk factors. Some parents have a greater risk of having a baby with Down syndrome. The risk factors include older age, chances of giving birth to a child with Down syndrome goes up with age because older eggs have a greater risk of unusual chromosomes. The risk of having a child with Down syndrome increases after a pregnant person is 35 years of age. I do apologise. But most children with Down syndrome are born to pregnant people under the age of 35 because they have far more babies. Being characters of the genetic translocation for Down syndrome, either parent can pass a genetic translocation for Down syndrome onto their child, and having had one child with Down syndrome, both parents who have one child with Down syndrome, and parents who have a translocation themselves are at a higher risk of having another child with Down syndrome. A genetic counsellor can help parents understand the risk of having a second child with Down syndrome. So the complications. So health concerns that result from having Down syndrome can be mild, moderate or severe. Some children with Down syndrome are healthy, while others may have serious health problems. Some health concerns may be more of a problem as the person gets older. So health concerns can include heart problems, problems with digestive system and digesting food, problems with the immune system, sleep apnea, being overweight, spinal problems, leukemia, Alzheimer's disease, and there are many other problems as well, such as thyroid problems, dental issues, seizures, ear infections, etc. So with the life expectancy, so over the years there have been advances in healthcare for children and adults with Down syndrome. Because of these advances, children born today with Down syndrome are likely to live a longer life than in the past. People with Down syndrome can expect to live more than 60 years, depending on how severe their health problems are. And there's also no way to prevent Down syndrome. So as mentioned before, there are the risks that create a high risk of having a child with Down syndrome, but there is no way to actually prevent it. Sorry, I do apologise. It's catching up now. So with the diagnosis, so according to the American College of Obstetricians and Gynecologists, they recommend offering the option of screening tests and diagnostic tests for Down syndrome to all who are pregnant, no matter their age. So there's a screening test which can suggest the likelihood or chances that you're carrying a baby with Down syndrome. These tests can't tell for sure whether your baby has Down syndrome. And diagnostic tests can tell for sure whether your baby has Down syndrome. Your healthcare professional can discuss these types of tests, advantages and disadvantages, benefits and risks, and the meaning of your results. If needed, your healthcare professional may recommend that you talk to a genetic counsellor. So the first trimester combined test is done in 2 steps. So these include a blood test, which measures the level of pregnancy-associated plasma protein A, which is also known as PAPP-A, and the pregnancy hormone known as human chorionic gonadotropin. I do apologise, that one was a bit of a difficult one, which is also known as the HCG level. Levels of the PAP-A and HCG outside the standard range may indicate a problem with the baby. And then there's the nuchal translucency screening test. During this test, an ultrasound is used to measure a specific area on the back of your baby's neck, and when certain conditions caused by chromosome changes are present, more fluid than usual tends to collect in the neck tissue. Oh, it's very cheeky now. So using your age and the result of blood tests and the ultrasound, your healthcare professional or genetic counsellor can estimate the risk that your baby has Down syndrome. There's also the integrated screening test, which is done in 2 parts during the first and second trimester of pregnancy, and the results of combined to estimate the risk of the baby having Down syndrome. So sorry, I've just got a bit of funny weather at the moment. The first trimester, so part 1, includes a blood test to measure PAP-A and an ultrasound to measure the nuchal translucency. Second trimester, the quad screen measures your blood level of 4 substances present in pregnancy: alpha fetoprotein, and estriol, HCG, and inhibin A. So cell-free DNA testing is a small amount of DNA released from the placenta into a pregnant person's bloodstream. This cell-free DNA in the blood can be examined for the extra chromosome 21 material of Down syndrome. For those at risk of having an infant with Down syndrome, the test can be done starting at 10 weeks of pregnancy. If the test is positive, diagnostic testing is usually needed to confirm that the baby has Down syndrome. So if your screening test results are positive or uncertain, or you're at a high risk of having a baby with Down syndrome, you might consider more testing to confirm the diagnosis, which your healthcare professional can help you weigh the pros and cons of these tests, which can include a chorionic villus sampling, or CVS, and their cells are taken from the placenta. They look at the baby's chromosomes. So this is usually done in the first trimester between 10 and 14 weeks. The risk of pregnancy loss, called a miscarriage, from a CVS is very low. And then there's also the amniocentesis. So a sample of the amniotic fluid surrounding the baby in the womb is withdrawn through a needle inserted into the mother's uterus. The sample is then used to look at the chromosomes of the baby. The test is usually done in the second trimester after 15 weeks of pregnancy. The test also carries a very low risk of miscarriage. So, diagnostic tests for newborns. Physical exam is usually enough to identify Down syndrome in an infant in the first 24 hours after birth. If your healthcare professional thinks that your infant has Down syndrome, your healthcare professional orders a test called a chromosomal karyotype to confirm the diagnosis. Using a sample of the blood, this test looks at your child's chromosomes. If there's an extra full or partial chromosome 21 in all or some cells, the diagnosis is Down syndrome. So with treatment, early intervention for infants and children with Down syndrome can make a major difference in improving their quality of life, because each child with Down syndrome is unique. Treatment will depend on your child's needs. Also, as your child gets older and entertains different stages of life, your child may need different care or services. So for people with Down syndrome, ongoing services include healthcare, education, and life skill support. So getting routine medical care and treating issues when needed can help keep a healthy lifestyle. There's also team care, where there's many different specialists that work together to help with the care of the child as well, and adult. So yeah, that's our deep dive at the moment into Down syndrome. We are also going to be going further into that again at a later stage with a guest speaker. So that will be absolutely amazing. If you would like to have your journey read out as a carer, family member, a support worker, or someone who has Down syndrome, please do send me a message. I'm more than happy to share it or have you on as a guest speaker. Same as you can also send me a message as well requesting a deep dive awareness done for a certain condition for you also, and I will gladly pop it down on my list of conditions that I'll do deep dive awareness posts on. So again, I do apologise if my eyes look a little bit funny or they're looking all around. I am blind due to a rare condition. But yes, thank you very much for taking the time to listen to the deep dive on Down syndrome, and we shall talk again very soon in the next either live or video. You can also go to the bio and click on the tree link and then click on Discord and Patreon, and then that way you don't have to wait for all the lives and everything like that on TikTok and YouTube and the other platforms, because we will all be available there. We all have a good laugh. We also support each other. There's extra content and different ways of communicating, etc. is well worth it. So do come along and have a look. And in the meantime, don't forget to like, share and subscribe, and I shall see you in the next video. Bye. Mwah.